And welcome back. If you're just tuning in, you're watching the Arthritis Show, a global information source dedicated to patients with arthritis and sports injuries. Well, joining us today is Catalina Florez. Catalina Florez practices physical therapy from here in South Florida. Welcome, Catalina.
Thank you very much for
having me. Great to have
you. Thank you.
Now, in your practice, I'm sure you get to see a lot of back pain.
Correct.
And what do you usually do for these patients?
Everything depends. Usually when they come to the clinic is around 45 minutes to an hour of an evaluation. We're basically trying to determine what kind of tissue is being mainly affected. Like you mentioned before, you know, L5S1 is one of the primary discs that gets herniated. A lot of the times people don't have many symptoms, but it progressively gets worse. By the time they come to the clinic, they may have multiple herniations, or we're dealing with massive muscle spasms, a lot of weakness, atrophy. So then basically we go from there. We start treating the symptoms, and our goal is just to get the patient independent.
Fantastic. Yeah. Is most of your patients males or females?
Usually with lower back, I will say males more than females. A lot of the times is because of work-related activities, just bad posture. Everybody's busy, you know, you're just trying to do your job as fast as possible, and it progressively just gets worse.
Fantastic. I understand you have a PowerPoint presentation for us?
Yes, sir.
Let's get that started. What is it about?
It's about arthritis and physical therapy. My name is Catalina, and you know, I work for Select Physical Therapy in Miami Lakes. We're going to talk about arthritis, some of the misconceptions about arthritis, and how physical therapy can help patients deal with those symptoms. Everybody knows, arthro means joint, itis means inflammation, so it's just a common arthro or inflammation of the joint. Usually we see patients with osteoarthritis and rheumatoid arthritis. Those are the most common types of arthritis that we see. Osteoarthritis is the normal wear and tear of a joint. Usually the complaint is morning stiffness. Usually lasts around 30 minutes. The more they move, the better they feel. Typically improves with activities. There was a study done in 2005, and there was an estimated 27 million adults with arthritis. So it's an number of people that are being affected by this. Rheumatoid arthritis, on the other hand, is an autoimmune disease. What it means is that basically your body's immune system is being affected and healthy tissue is being attacked. It usually affects not only the joint, but the cartilage, the ligaments, soft tissue around it, including capsule. Typically have a lot of joint stiffness. The pain lasts over an hour. Typically is bilateral pain. There was another study done in 2007, and there was an estimated 1.5 million adults that were diagnosed with rheumatoid arthritis.
That's of course a little bit much less common. It's probably we get to see probably 1 to 2% of our patients.
Correct.
How often do you get to see that?
Exactly the same. It's very, very minimal. You know, that we see is just basically
osteoarthritis is a much more common entity than rheumatoid.
And some of the statistics shows that arthritis and rheumatic conditions are the most common cause of disability in adults, and it has been, for over 15 years. The Center of Disease and Control and Prevention published in 2009 that around 4 million adults were diagnosed with arthritis. 27% population in Florida had arthritis. There's a ratio of 30 to 24%, so more women than men. 31% white, compared to 18% African Americans and 14% Hispanics. 68% were overweight. This is a major red flag because it's something that we can actually work on, or somebody, can actually, work on it if they get into a exercise routine.
That you could certainly modify and improve it. Yes.
Exactly. One of the misconceptions that we see a lot with our patients is that they're diagnosed with arthritis, and what they do is that they become sedentary. Once they become sedentary, then what's going to happen is that they're going to start losing muscle. We're going to start now dealing with muscle atrophy. Now their joints are going to become unstable. So now you're not only dealing with a joint that is arthritic, but now that it's unstable, you're going to see more irritation, more inflammation, more pain. This is going to lead now into losing balance, losing proprioception. Now the person is going to be more prone into falls and further injury. And we hear all the time in the clinic saying, oh, I had knee pain and I was protecting the knee so much that I didn't realize I fell and actually fractured my hip, and I'm here for therapy because I have a hip fracture, which is, you know, one of the #1 surgical procedures. As a physical therapy, basically our goal is to break that circle. We want to get the patient going. We want to teach the patient that they can manage their symptoms and they can slow down the progression of the arthritis by moving. Even though there's no cure, at least once you move, it's going to get better. Physical therapy evaluation goals is to basically develop that specific treatment plan for that patient. That's why it takes around 45 minutes to an hour for us to get that treatment plan set up for them. Physical therapy is more than just heat, ice, ultrasound, and massage. Some patients have that belief. Physical therapy means physical. You have to move. The only way that you're going to get better is by you moving.
Yeah, that's the key thing, and that's what we're trying to emphasize on that video, that you know, a human body is the opposite of a machine. A machine, the more you use it, the more you lose it. It breaks down. Human body, if you don't use it, would start breaking down. You gotta keep things moving, because by moving your joints or stretching them, you would be increasing the circulation of the blood, and therefore you carry more oxygen, more nutrient, and more everything that your joint needs to stay healthier.
Excellent, yeah. So in physical therapy, what we do is we work on flexibility, range of motion, a lot of strengthening, stability exercises. We use a lot of manual therapy techniques. It includes belts, wedges. We use traction for cervical or lower back dysfunctions. We use taping if we want to emphasize a muscle contraction, or if we actually want to inhibit pain. So we can actually use all those tools that we have. Our clinic, we're very lucky because we're inside of Schulis Athletic Club. So our goal is to get the patient independent and transfer them into the gym so they can continue with their routine. The gym also offers what is called silver sneakers. So it's a Humana program that would actually pay for the gym. So that's one of our goals, of transition the patient into an independent program. We emphasize them joining, Tai Chi, yoga, Pilates classes, or even a personal trainer. Now, once that joint is being controlled, the pain, the symptoms are controlled, then they can actually start working on weight loss, which is that big epidemic that everybody's trying to control these days. And we recommend going and speaking to a nutritionist.
Fantastic. We also advocate the Tai Chi and yoga and Pilates. We also highly recommend to our patients to do swimming, because you're weightless and it's very effective. And again, this movement is very important. Well, thank you very much for this excellent presentation. All right, we'd love to have you again back here.